Right, let's pick up on that. 2 days on and no confirmation on when our Johnson & Johnson healthcare workers vaccination program will resume. Halted on Tuesday due to the USA decision to pause their J&J rollout over the possibility of a link to a very rare blood clot condition. America's Center for Disease Control saying they need more time to decide the way forward. Let's talk now to Virologist Professor Barry Schoub, head of the Ministerial Advisory Committee on COVID-19 vaccines. Prof, good evening. Thank you very much for your time. So do you know when our vaccine rollout is going to resume?
Good evening, Sally. No, we don't know as yet. They are still investigating the issue. Remember, we have to keep in very close contact with the Americans because they've rolled out just over 7 million doses, and they've picked up these 6 what you call safety signals at this stage. So we do need to watch very closely what the FDA, the Food and Drug Administration, United States, what they're doing, and also obviously looking at what's happening here. So I think it's not going to be too long. I think it's going to be probably a couple more days. But at the moment, we don't have a definite time when it's going to resume.
7 million, in fact more than that, Johnson & Johnson doses given out in the USA. 6 cases of this extremely rare blood clotting condition. 1 death, as I understand it, currently. Is that enough to stop the Johnson & Johnson rollout completely in South Africa? If you compare it to how many people die from blood clots as a result of COVID-19, it's much less. COVID-19 blood clots cause much more death.
Yeah, you're right, Sally. I know. I can understand the sense of frustration, not amongst the lay public, but also amongst our medical colleagues. And I've had so many kind of questions fired at me in regard to this. I think what we must remember is that the rollout, it's not really the rollout, the actual implementation study, that's the correct term, or phase 3B trial, the Sasonki program of the Johnson & Johnson comes with a certain amount of conditions.
Yeah.
In other words, it has to have an independent monitoring board. One of them is an ethical board. And I think the minister alluded to the ethical board not being happy with continuing and putting a pause on because there is a safety signal. So obviously it is a moot argument. Do we need these kind of control? And I think we do. You know, this is a new vaccine, and I think these signals need to be investigated and we have to be reassured. One of two things: either that it is not related to the vaccine, which is still a possibility. We don't know for sure that the vaccine causes these blood clots, and even if it does, how common is it? As you said just now, it's vanishingly small, far less than the kind of background incidence of thrombosis. So yes, you're right. It is frustrating. It is difficult maybe to comprehend. But remember, it's not the rollout. The rollout is still carrying on. This is the implementation study, which was used for urgent immunization of the healthcare workers.
Yes, and of course, as part of that study, one is obliged then to call a halt because it is part of a research study. But does that suggest we're going to power ahead with phase 2, which is the actual rollout, registration, online registration to stand in line for a vaccine? That begins on Friday, the 16th. Is that online registration still going ahead on Friday?
Yes, well, my information, and that's in fact from this afternoon, we were told from the Department of Health that, yes, that is going ahead from tomorrow, actually. Tomorrow is Friday the 16th. Yes.
That is good news. Now, the 2 vaccines with possible links to blood clotting, J&J and AstraZeneca, my understanding is that they're both the same sorts of vaccines. They both work in the same kind of way, but Pfizer is different. And Pfizer, of course, is coming in May. Could you explain the difference between the 2 types of vaccines for us? And are there any health concerns at this stage around Pfizer?
Yeah. Well, AstraZeneca and Johnson & Johnson use what's called an adenovirus vector. Adenovirus is a fairly harmless virus which is used as a transporter, what you call a vector, and it transports the gene which is spliced into that virus into the cells of the body. Once the gene is there, then it makes proteins, which then stimulates the immune system. With regard to the Pfizer and the Moderna, they don't have a carrier. They are the actual genetic sequence of the virus, which is introduced into the cells via inert lipid, fatty kind of nanoparticle, very, very tiny lipid particle which directly takes it into the cell. There it expresses the protein and stimulates the immune system. So they are quite different in that sense. The actual platforms are different. But even between between AstraZeneca and Johnson & Johnson, there are some differences. They do share the same, what you call platform, that adenovirus platform, but the adenoviruses are different, and the inserts, that little genetic component, is also a bit different. That's why they do behave a little bit different from each other. But both of them share the problem that there's been association with the clotting problem. Now, with regard to the Moderna and the Pfizer vaccine, they're what you call mRNA, messenger RNA. That's the genetic component of the virus. This clotting thing has not been found as yet.
All right. Now, Nahawu has called for other vaccines to be explored, and the president, speaking in Durban, has said that we're looking at China, Cuba and Russian vaccines. But I want to ask you about Novavax. I interviewed Professor Shabir Ahmadi, and he told this channel that he's actually quite puzzled why we are seemingly not moving forward on acquiring this vaccine, because he said it's shown to be 100% effective. So what's the problem?
So there's no real problem. We haven't dismissed Novavax. We haven't dismissed AstraZeneca even. I think we put a pause on AstraZeneca, or suspension on AstraZeneca, simply because there was no data on how effective it was against severe disease. And that's obviously the main thing that you want to prevent. And the same thing at the time also applied to Novavax, that there wasn't data, certainly from the trial that Professor Mardi carried out. The data didn't show that there was effectiveness against severe disease. So we couldn't really kind of advocate using Novavax until we got that data. Now, since then, there has been some data which has been forthcoming, and we are going to be meeting with them fairly soon with Novavax to re-examine it. But at the time, we couldn't really advocate for a vaccine where there was no demonstrable, proven efficacy against severe disease.
I want to ask you about the new infections. My understanding in the last 24 hours, it's been about 1,600. That's more than we've sort of seen. I know it's been a bit up and down, but it's been between sort of 400 and 1,000 every day. Could this be the beginning of the pickup post the Easter moving around, or is it just too early to say?
Sally, I think it's probably a little bit early to say. Obviously, there's a little bit of a concern because, as you say, up to now, it vacillates between 500 and 1,500. There's a slightly above that. So we are watching it quite intently. But I think it's probably too early to say, look, this is the beginning of the third wave. I think it's too early at this stage. At the moment, the transmission rates are still fairly low.
All right. Well, thank you so much for your time. We do appreciate the update that you have for us, telling us he thinks it will be just a few more days needed to assess the Johnson & Johnson vaccine, and that the online registration does start on Friday for phase 2. That was Professor Barry Schoub there.